Good afternoon, Madam Chair and members of the committee. Thank you for the opportunity to appear before you today on behalf of the Canadian Animal Health Institute, the National Trade Association representing developers, manufacturers, importers, and distributors of veterinary medicines in Canada. CAHI members account for 95% of animal health product sales in this country, including veterinary drugs, biologics, feed additives, and pest control products. We're deeply invested in the health and welfare of Canada's livestock and companion animals and in the prosperity of our agricultural sector. CUSMA is foundational to the stability and competitiveness of Canada's animal health industry. Healthy livestock are essential to a secure and productive food supply across North America. The medicines, vaccines, and diagnostics produced by our industry form an integrated supply chain that supports food safety, public health, and economic vitality. The Canadian animal health sector contributes directly to public health, food safety, food security, and economic growth, with a market value exceeding $4 billion. As of 2024, Canada maintains 12 million cattle and 14 million hogs, generating $40 billion in livestock receipts. The availability of effective veterinary medicines is critical to this productivity. Canada relies heavily on the United States for veterinary medicines and vaccines. Approximately 40% of all medicines and 90% of vaccines for food animals are imported from the U.S., and for companion animals, at least 40% of medicines and nearly all of our pet vaccines come from our southern neighbour. This dependency underscores the vital role of CUSMA in ensuring access to affordable, high-quality veterinary medicines for Canadian farmers and pet owners. CUSMA has delivered tangible benefits to the Canadian animal health sector by eliminating tariffs, improving market access, and establishing science-based regulatory disciplines. The agreement has lowered costs and increased access to essential products. This has led to reduced disease prevalence in both food and companion animals, higher productivity and lower food prices due to improved livestock health, and competitive advantages for Canadian producers. Canada accounts for 15%, or about $96 million, of U.S. exports of veterinary drugs, reflecting the efficiency and cost savings of integrated regional supply chains. CUSMA's stable and predictable framework has enabled Canadian businesses to plan investments, streamline product development, and deliver innovations that protect animal and public health. Regulatory cooperation is a cornerstone of CUSMA's success. CAHI members have benefited from Canada-US collaboration during product review and approval, which reduces duplication and accelerates the availability of safe, effective medicines. We strongly support continued Canadian leadership to enhance this cooperation, ensuring that regulatory decisions remain science-based, transparent, and harmonized where possible. Regulatory predictability allows companies to invest confidently, develop new products, and deliver critical innovations. To build on CUSMA's achievements and remedy the animal health industry's ongoing trade irritants, CAHI offers the following recommendations. The first is defending strong intellectual property standards. The current data protection provisions incentivize innovation for new chemical entities, but do not adequately support research for new uses of existing drugs or minor-use, minor-species drugs. We urge the government to broaden data protection to include new uses, with a meaningful period of protection for new data generated. The second recommendation is advancing regulatory reliance, moving beyond cooperation to true regulatory reliance. When an animal health product is approved in the United States, Canadian regulators should rely on that review to the maximum extent possible. The upcoming 2026 CUSMA review is an opportunity to catalyze this shift. The third is strengthening the use of international standards. The common adoption and implementation of international standards, such as the guidelines issued by the International Council for Harmonization of Technical Requirements for Veterinary Pharmaceuticals, are essential for eliminating costly and duplicative animal studies across jurisdictions. The fourth is aligning maximum residue limits. Misalignment in MRLs for veterinary drugs creates costly trade barriers. The cooperation envisioned in Article 2817 under CUSMA should be more effectively applied to ensure MRLs are established in a timely and coordinated manner between Canada, the US, and Mexico. And finally, the fifth recommendation is modernizing domestic regulatory frameworks. That would involve actively using the retrospective review mechanism outlined in CUSMA Article 2813 to update and improve Canada's regulatory environment for animal health products. CAHI strongly supports a full 16-year renewal of CUSMA. The agreement has enhanced North American competitiveness, strengthened supply chain resiliency, and promoted science-based regulatory alignment, benefiting Canadian farmers, animal owners, veterinarians, and the broader public. CUSMA is crucial for ensuring access to essential veterinary medicines, supporting food security, and maintaining Canada's position as a reliable global supplier of high-quality animal protein. Strategic trade and economic integration with the U.S. and Mexico enhances our capacity to manage animal disease outbreaks, uphold food safety standards, and protect human health. CUSMA provides transparent rules and stability needed for Canadian businesses to plan supply chains and build lasting customer relationships. Thank you for your attention, and I look forward to any questions.